Welcome everyone to our first annual virtual career fair. My name is Brian Kaufman. I am the chair of the Social Work Occupational Council. That's an affiliate of NASW California. And we welcome a couple of employers here. Please introduce yourself, starting with Mr. Jesse Montes.
Good morning, everyone. My name is Jesse Montes. I'm the Chief of Social Work at Metropolitan State Hospital in the city of Norwalk. I work for the Department of State Hospitals, which is a state agency that has 5 state hospitals throughout California. I'm glad to be here. Thank you.
Very good. Thank you. And full disclosure, Mr. Montes is my own boss. And next we have Cortne Bui, if I'm pronouncing that correctly. Go ahead.
Hi, I'm Cortne Bui. I'm a behavioral health manager with Kaiser Permanente in Fremont. And I work specifically in the only med psych unit for Kaiser Permanente. Thank you.
Thank you very much. We had AJ Solomon here. AJ, are you there? I couldn't reach her earlier. Are there any other employers that we missed?
I see her name and
I know
they're unmuted. She's unmuted, but not sure. Can you put something in the chat?
I tried to contact her earlier. I don't know.
Oh, interesting.
Is there anyone else? Okay. Let's get started with the questions. Employers, would you like, starting with Jesse, would you like to talk about the job and what would a prospective, what should a prospective employee know about the job?
Sorry, Brian, did you say for us to start?
Yes,
for me to start?
yes, go ahead.
Okay. Yeah, so at DSH, we do hire for the clinical social worker position. It's a state safety position, working in forensic psychiatric hospitals. Currently, there are openings at DSH Napa and DSH Coalinga. I believe there's also openings that will be posted soon at DSH Atascadero. We recently hired at DSH Metropolitan, and we're the closest facility to Los Angeles. And there's sporadic openings that we post throughout the year. So the best place to check for openings and to see where the current vacancies are is at our CalHR website. So that's calhr.ca.gov. At the website, you can cruise through and see various vacancies throughout the state, not just at the Department of State Hospitals, but also the Department of Corrections, the parole outpatient clinics, and a variety of other settings where they do hire social workers on a regular basis. At DSH Metropolitan, I did bring the salary range with me. So the starting monthly salary for our new hires that are unlicensed is $6,568 per month. You get yearly raises, which maxes out at $8,987 per month. And that is for unlicensed folks. Once you become licensed, or if you are hired with the license already, the starting salary is $7,066, and it tops out at $8,987 per month. And of course, there's promotional opportunities in the state. We have senior social workers, we have administrators, so there is a pathway for upward mobility. And we do offer a CalPERS pension, also the health and dental and vision benefits, along with paid time off, vacation, and sick. I don't know. Is there anything else you want me to share, Brian?
We'll get we'll get to that.
Okay.
Cortne, go ahead, and same question.
Sure. So I specifically for my unit, I have 2 positions available. My unit is an inpatient locked unit, and you must be an LCSW. So the position, I will share the salary info, but one position, both of them are on call. So you're working on the weekends, you'll give availability, and then we'll schedule you accordingly. One position is as a therapist. You would do therapy with the patients, individual therapy, group therapy, assessments. And then the other position as a discharge planner, you would focus on working on the patient's discharge, making sure everything is set up, meeting with them. So you're doing like a mini assessment with them each time you meet with them, and contacting whatever providers they might need for follow-up care. But as you know, my organization's pretty large, and I was just pulling up that I think there might be like, you'll have to filter it. I'm going to put the link in chat, but there are many positions available in the outpatient. If you're interested in working in the outpatient setting, hundreds. So it's just really about, what are you interested in working on? As far as salary range, let me get to that. I think it's like it's per hour that we calculated, and it's 51 to 59 an hour. And when you look at the job postings, it'll say, because each one might be a little different. I have a document that shows our benefits also that I can share, and maybe Brian, you can let me know when you want me to do that. Thank you.
Excuse me, what did you want to show?
Oh, I have a document that lists our benefits.
Oh, yes, wonderful. Can you post that to the chat? Or we can send that to all the participants that registered. You can email that to me and I can forward it.
Yeah, I think so. Yeah.
Okay.
Okay. Thanks.
Thank you. These are positions all requiring LCSW, is that correct?
Majority require LCSW. There is a position we have that is accepting an ASW.
Okay.
It is at our sister facility in Santa Clara, and it's a 24-hour position. So
Okay.
we have a crisis stabilization program there. So there was one, and I can put, do you want me to put those links in the chat?
Please do. Thank
Okay.
you.
Okay, I'll work on that.
And does any of those, does that position require any prior experience?
I was looking at it last night. I don't think it's required. It's probably preferred, but
Preferred, but not
I
required.
didn't. Yeah, I didn't see required. So just make sure you look at it closely.
Very good. Thank you very much. Appreciate it.
Thanks.
Well, very good. You both did your homework. So now I'm trying to figure out what other questions I wanted to ask. Most of these positions are regular day shift 9 to 5 type positions. Is there any and you also mentioned there are night shifts and there are weekend shifts, there are 24-hour positions. Is there any part-time positions? There are part-time positions. All right.
A lot. Yes.
Very good. Very good. Claire, did you have anything?
Yeah, I was just wondering what like the day-to-day looks like. I know for the therapist position, you already mentioned some of the activities that this individual would be partaking in, but is there anything else you can mention about just what the job looks like, what the documentation looks like,
Sure.
scheduling, things like that?
Sure. For the therapists on our unit, you would either work. I have someone who works early right now, so you would probably be working like a 10 a.m. to 6:30 p.m. shift. And every day there is a group that you will facilitate. So, and it's always CBT, DBT. We also do illness management recovery groups. We also have a chemical dependency recovery group. So you'll do that. If there's a new patient, then you would need to do an assessment, initial assessment with them. You would need to check in with patients. We also have eating disorder patients, so they require a little more care, and we see them every day. to provide them a worksheet and check in with them. So I think that's kind of a snapshot of the therapist. For the discharge planner, it depends if you have someone already lined up to be discharged, and you probably just want to button everything up, make sure transportation's set, appointments or follow-up appointments are all set. Other than that, then you would just be rounding and seeing the different patients and seeing what part of their discharge plan you need to work on.
You're on mute, Brian.
Okay, very good. Jesse, we have the same question about what does the job entail? What does a typical day look like?
Sure. So our hospitals are inpatient psychiatric hospitals. Most units, have 30 to 50 patients. Sorry, that's a lot. 30 to 54 patients. The standard caseload is around 20. The day-to-day is, when people get hired, they start off working Monday through Friday, 8 to 4:30. After a probationary time period, they can apply for an adjusted schedule where they can work 4 10-hour shifts, or they can also work the standard 5 days, but 1 day at home, a telework day. DSH Napa and DSH Coalinga are offering 2 days of telework and 3 days on site. So the typical day-to-day is, the social workers start off with interdisciplinary meetings, treatment team conferences. They run treatment groups. We require social workers to run 7 hours a week of treatment groups. And then they also are required to provide daily interventions with whatever population they're assigned. So we have an LPS 5358 population, which are the long-term conservatees from various counties. We also have a incompetent stand trial population, and some of the hospitals also have offenders with a mental disorder, not guilty by reason of insanity, and the sexually violent predators at the Coalinga State Hospital. So there are various populations to work with. The day-to-day depends on which population you're working with, but we primarily do discharge planning, group therapy, individual psychotherapy, case management. And the notes, as far as there was a question about documentation. We do 30-day biopsychosocial assessments, discharge notes, admission notes, transfer notes when we move people around. We require monthly notes. We don't require notes like some facilities and agencies for every contact you have with a person. Typically, we're documenting monthly on people's progress at our facility, and we don't do any billing like some agencies do billing. We don't do that. We don't bill insurance companies with the state, and that goes for CDCR and DSH for the most part. So yeah, there is documentation. We're very thorough in our assessments and things like that. So, and we also report to the court. So we write court reports, and we're very involved in all of our, patients have some type of case, either criminal case or civil matter where they have to go to court. And so we're, constantly communicating and things like that with the court. So, thank you.
You're still on mute, Brian.
Jesse, there was a question in the chat regarding any opportunities for policy program analysis.
Yeah, so actually in recent years, there have been some specialty positions that have opened up. Typically, we don't hire directly for those positions, but once a clinical social worker is trained in the basic day-to-day and they're there for a little bit, they can apply for some specialty positions that are more macro in nature. We have things like substance abuse coordinators that manage substance recovery programs. We have discharge specialists, people that specialize in not only complex discharges, but also macro policy statewide, and really looking at policy and rewriting, outdated policies and such. We have trauma-informed care coordinators who often are social workers. So there are a lot of opportunities for macro work, including policy analysis and even writing policies. So yeah, if you have that interest, for us, you might have to start off as a clinician, but then, you can branch out to more macro social work if you're interested in that. And management, of course, if you're interested.
Very good, very good. I think that's all the questions I have, so we'll open it up to the forum here. Does anyone have any general questions for our employers before we break out into rooms? Yeah, okay.
Is there
Clara,
anyone
is
in
there
the
anything?
Is there anyone in the waiting room by any chance? Just want to make sure everybody's getting in. Someone's asking about per diem MSW. Is that for Cortne? Is that question for Cortne?
One of the links I posted is a per diem MSW. You have to be registered, so it is, where is it? There it is. Okay. I'll post it again and then try to say next to it ASW. Okay.
Oh, we have one more in the chat. Any tips for standing out as a recent graduate looking for jobs? So any general guidance that you would like to share?
Yeah, I can start with that. So, depending on where you did your internship, you may have got some exposure to adult mental health or psychiatric, treatment, inpatient psychiatric treatment. Those types of things are helpful on your resume. They're not required for the position, but they are helpful. I would suggest that if you don't have that type of experience and you do want to work in a locked inpatient setting, or you want to work at a state hospital, it might be good to maybe start off getting a job in that field, as in, in adult mental health. If your internship was working with children, for example, we don't treat children at our agency. So you might want to start off and get some experience. And then once you have that, apply. We do require a training and experience exam as part of the hiring process. So if you go to the CalHR website and you try to apply for the position, you're going to fill out a state application, but you're also going to do a separate exam called a training and experience exam. It's a few pages. It's, you kind of rate yourself as far as experience. And with that, you may or may not be called for an interview. So if we are hiring and we're only going to hire, for a few positions and we have many, many candidates, sometimes they will look at your training and experience, and they could look for something like at least 1 year of experience with adult mental health as basic criteria. So, I guess to stand out, get some experience if you didn't already get some during internship. And then, of course, do your homework on the agency. You can look at our website, or each hospital has their own website. You can do some research on what populations we treat. You can look at the evidence-based treatment models for those particular populations, things that work. Look at the literature on, kind of the innovative, cutting-edge type treatment that we do. And just come into the interview with a positive mindset and having done your homework a little bit, and just do your best. And sometimes we only have one position open and there's a lot of candidates, and you might have to try again. You apply, you interview, and maybe you don't get it the first time. There's times where we hire 5 to 10 people all at once. We're opening a new unit or something, and you may apply at the right time where and there's some state hospitals that are really in a situation where they need people more than others. There's some hospitals that are short-staffed. And so I mentioned DSH Coalinga and DSH Napa. If you're having trouble getting into DSH Metro or DSH Patton because we're LA and San Bernardino, they're more densely populated areas. If you're willing to relocate, there might be more vacancies at those facilities if you're willing to move up to Napa. Or Coalinga doesn't have a whole lot of housing in the area, but it's not too far from Fresno. So if you're willing to live in Fresno and commute, it's a good place to kind of get your foot in the door as well.
Jesse, you mentioned the word exam, that piqued somebody's interest. So what do you mean by that? And I know there are other county agencies that do exams. So can you elaborate more on what that entails?
Sure. So it's essentially a screening tool that the state Human Resource Department uses to look at people's experience. So before you even interview, you kind of submit your own experience. You know, where you, of course, you tell us what school you went to and what degree you have, which, you know, we require MSW, of course. But in addition to that, you have to document what experience you have in the field, and you have to rate yourself on what areas you have. So for example, on the training and experience exam, it might say, how many years of inpatient treatment have you provided? And then it'll say, you know, 0 to 6 months, 1 year to 2 years, 3 years to 5 years. It'll have different, and you rate yourself. You know, I have 1 year experience during internship. And at the end of that, there'll be kind of a minimum score that the human resource is looking for you to qualify for an interview. So if you don't have enough experience, you may not qualify for an interview, is what I'm saying. But, you know, like I said, there's a lot of vacancies at certain hospitals where the bar for experience may be lower. For example, you know, Coalinga, they may accept, you know, 3 months of experience or 6 months of experience, where Metro may only accept 1 year or something like that. So, so what I would say is, if you do the training and experience, it's not a test like where you're getting it right or wrong. It's more of a screening tool to see how much experience you have and how much training you have.
Cortne, did you want to share some tips for folks wanting to apply to Kaiser? I know most of your roles are LCSWs, but if you have any tips for.
Yeah, I just remembered there's also in the hospital, we have medical social workers, and those positions are MSW. LCSW is not required. So that could be something you could look into when you're on our website. I just have really the simple standard things, such as please look professional. Please do your homework and know what job you are applying for, and really try to cater. Like if you had an internship at a hospital, make sure you're really pressing in on that, because like that you said, you want to stand out. Please don't say that you're an expert and you know everything, because I don't think any of us, I mean, we might have a little bit of expertise, but we're all still learning so much every day, right? So I think the humbleness really helps. Be yourself, because we want to see who you are. We want to see if you're going to be a good fit, and have some good questions to ask us at the end, because I think that helps you figure out, are we going to be a good fit for you? Thanks.
Do you have any tips to actually getting to the interview? Because I think some people are getting stuck just at sending their materials and standing out.
Yeah, so you have to look at that job description really carefully and see what the requirements are. So if the requirements are 1 year of inpatient experience, then you need to make sure that you have that, because otherwise you are not going to pass that first door. You're going to get that little rejection letter. So really making sure, okay, do I qualify for this? Is it reflected on my resume? Is it reflected when I do the application online?
Yeah, and I think some people get stuck on, well, I need experience to get to these positions, but to get to these positions, I need the job, you know, to have the experience. So I think, you know, that's where you have to really leverage your internships. Like if you can work at your internship site for a year, to be able to have that 1 year to put on your resume post MSW, that your internships already know you, like you're already known to them. And if they've liked how you've been, they would love to hire you on. Then that's how you have to be able to leverage that in order to move on to other positions that are saying 2 years post MSW or 1 year post MSW work, right? But you've spent 9 months essentially interviewing. So really, even if it's not your ideal forever job, if it's a job that will give you enough like experience and resume building, it might be worth staying at that internship for at least a year.
Thank you. You just reminded me of another thing. We do have, I guess the best word is practicum. So we do have positions for ASWs. And it's really, it's a 1-year position and there's training, lots of didactic trainings involved. This is for people in the outpatient. So I will include that link and you can take a look at it. The pay is substantially less, but I think you just need to ask yourself, well, can I do this for a year? Is this the training I want? Is this the environment I want? And then you have that and then you move on.
Brian, we can't hear you.
AJ Solomon has finally joined us. Go ahead. Please tell us about yourself and your company.
Yeah, actually, I'm AJ Solomon Joel. So thank you so much for introducing me. Can you hear me now?
Hello. What? So tell us about the position you're hiring for.
So I'm looking for any social work background position. So is there any opportunity? It will be helpful because I'm from India.
Oh, I see. So you're not you're candidate. You're looking for a job. You're not.
Oh, you are?
Yeah, I'm
Oh,
looking
you're not
for
an employer.
I see.
No, I'm not employer.
I see.
Oh, I'm
Yeah.
sorry.
So I think most of the jobs, at least I know from Kaiser and state hospitals, they don't sponsor international employers, right? Like that, especially for the state hospital ones. I'm not sure if we have any positions, at least in this cohort, that hires any international candidates.
Yeah, I'm not aware of any either. All right. Are there any other questions for the group? Okay, so let's put you all into rooms.
If
Yes.
we put, yeah, so we're gonna put Courtney in one breakout room and Jesse in another breakout room.
Yeah,
And then
so
the rest of
Courtney,
you
you'll
can
be number
decide.
1, Jesse, you'll be number 2, and we're gonna let you all choose which one to go to, and we'll just leave it at that.
And if you have general just job application questions, like you just have resume questions, things like that, that you want to ask Brian and I, you can stay in this room and we can
Yes.
answer.
And thank you all for coming. I'm going to end the recording here. So appreciative of you all coming in and doing this. And we will be posting this to our YouTube channel, NASW-CA SWOC is the, and if you have, and I'm going to put in my email address here, NASW-CA SWOC@gmail.com. If you have any further questions, and that will conclude our presentation here. And thank you very much. And go ahead in your breakout rooms.